Hello everyone, my name's Laeticia Sevin and welcome to the International Opportunities Podcast. This series will give you an insight into our students' first-hand experiences abroad, whether that be a study exchange or work placement. From Fiji to Canada, our students have done amazing things abroad and we want to showcase that to all of you. If you're thinking about going abroad for your studies or for work, then this series will hopefully give you some inspiration, tips and advice. Today I am joined by Amira Rouini, who is a third-year adult nursing student at the University of Salford. Hi Amira, thank you for joining me. How are you?
Hello. I'm all right, thank you. Thanks for having me.
Thank you so much. Now, can you tell us where you went for your work placement and how long for?
So it was the destination Zanzibar in Tanzania, East Africa, and for 4 weeks. Placement.
Wow. Lovely. Now, what was your initial impression of Zanzibar when you first arrived? Were there any surprises or culture shocks?
Not that. To be honest, I was impressed about the beautiful sandy beaches.
Oh, it looks amazing.
The sunshine, the nice weather, the delicious local cuisine.
Mm-hmm.
So I tried some of their local dishes. It was a great time there, to be honest. So I didn't have any kind of shock or anything.
Brilliant. And what inspired you to go to Zanzibar?
I wanted to try to practice in East Africa. For me, Africa is different than Europe because there was a lot of other destinations such as Australia, America, Finland, and so on. But I wanted to see the other side of the world. So yeah.
Definitely. And what were some of the key differences that you noticed between the healthcare system in Zanzibar and the NHS in the UK?
To be honest, there was a lot of them, but some of them I'm going to mention today. First, here in the UK, the NHS is a tax-provide healthcare, so we go to the hospitals without paying. However, in Zanzibar, if you don't have money, you can't pay for your healthcare, So also, they are knowledge-based practice. We are more digital-based practice. Right. We still use our knowledge, but without computers, without documenting in the computer, really we can't do it well. There is less digital use. There is a quality of care there. It's a bit not really like here because of the lack or low of resources, so all affecting the healthcare provision.
Right. And how was it like adapting to a completely different healthcare system?
For me, because it was an observational clinical placement more than practicing.
Right.
I'm learned based on the standards of the the NMC Code of Conduct. So in there, they don't have really same standards. So I'm not really allowed even to put my hand in because what I learned, I can't practice in there due to the lack of resources, different practices, the healthcare professionals, there is some infection control that is not maintained. So there is a lot of factors that really made me just step in a way, just observe and learn different experience.
And can you elaborate on your experience working in the dermatology unit and what made it particularly memorable to you? We did have a little look at your global report. And
I can see. Yeah. To be honest, my placement was like a spoke placement because I was in A&E for 2 weeks. Then I wanted to try go into the dermatology as I didn't have any exposure in here. The knowledge-based practice and the teaching approach the doctor use to teach the nursing staff, the junior doctors while assessing the patient was really brilliant. I never experienced something like that in here. There is, in the UK, to be honest, doctors maybe heavily rely on computers. Go and do an assessment, take long process.
Right.
There, diagnosis quickly done. And they don't really look at the computers too much unless they will record the patient's details or update any medication. It's all from their mind. The doctor will blow my mind away, to be honest, with the way he's assessing the patients, teaching the nursing staff, teaching the junior doctors, as well as the international students, and then diagnosis of the patient and then all done.
Wow.
There your treatment. You can take it from pharmacy.
They just retain all that information in their brains.
Really nice.
That's incredible. Now, how did you navigate the language and the communication barriers, especially when you were interacting with patients and local staff?
Yeah, we've been told that it's a Swahili language, so we've been advised to learn a few words, which I did. I learned a few greeting words. It was not easy at the start, but to be honest, I'm Muslim, and the country I went to is Muslim country.
Yeah.
They use a lot of Islamic words, and so Arabic as well. So I find it easier comparing to my colleagues to really communicate. I've still used some greeting words in Swahili, which is African language. However, I used more like Assalamu alaikum, other words like Islamic ones, you know. Yeah.
That's brilliant. So you were at a bit of an advantage there as well.
Yeah.
Now, you mentioned that this experience helped you build relationships with people from diverse backgrounds. How did these interactions shape your personal and your professional growth?
Yeah, so building relationships with individuals from diverse backgrounds, such as Zanzibar place, it's really contribute to both my personal and professional development. So for the personal level, this interaction foster a cultural awareness and allowing me to know more about various traditions, perspectives, enhance my empathy, allowing me to go deeper on my connection and understanding among individuals, especially patients that I looked after when I'm on placement. Also, the people outside when we passing by, going around, just, you know, professionally. There was a lot of things. Cultivating a diversity of network. It's a new opportunity anyway of collaboration, exchanging learning experience. So resilience, working under crisis, working with low resources. It's a lot of good advantages from this experience I can use in future.
I guess you learn a lot from the challenges that you face.
Yes.
So what would you say was the most challenging part of the experience, and how did you overcome it?
I have a personal challenge, to be honest. Before going to Zanzibar, I lost my mom not long time ago. It was 17th of October. Yeah, thank you. I try to overcome all my emotions and try to be strong and practice and so. But when I have some deaths in the A&E when I did my placement, or some very challenging situation with patient deteriorating or end of life, it's really reflect on my personal experience, and I feel really, really bad emotionally. So I do my job then, but I debrief. I use debrief later on to disclose what I feel, just to release that stress, that emotions, you know.
Brilliant. And did you feel that you had a support system while you were there?
We were very nice together, me and my colleagues, to be honest. We chat to each other. We can find out if one of us not feeling all right. So we say, okay, have 85 minutes. You want to have a talk? We used also a weekly debrief with the university, which really helps, you know, to talk about what happened, what went well, what went bad, what we're going to reflect about.
Okay, was that with your exchange coordinator?
Yes.
Oh, that's brilliant. That's really good. And well done for you for going there and overcoming that. And yeah, I'm so glad that you had a good support system whilst you were there as well. Yeah. Now, you mentioned learning Swahili during your time there. How important was it for you to connect with the local culture through their language?
It's very important. I'll say before heading to Zanzibar, try to learn a few words at least.
Yeah.
Try to, if you stay in a longer time, use that time to communicate with others.
Yeah.
They still speak a little bit of English, so you can use this opportunity to learn. It's a learning opportunity for you. I learned few words which I used. I feel happy because it made it easy for me to communicate, especially with patients.
Yeah.
Because professionals, they still speak some of English, they understand, like students, professionals, nurses, doctors.
Yeah.
But the patients, most of them say, let's say 85% or 90%, they don't really speak English. I need really to use either few Swahili or use one of the staff to translate, or facial gestures, or other communication style.
Now, what insights did you gain about patient dignity and cultural differences in healthcare treatment?
I don't want to talk about that side, just to mention a few words. Due to the healthcare crisis that practice in there, lack of resources, no equipment, different practice, dignity not always maintained due to these factors. It is they are trying their best, but because it's really busy place. Like I'm talking about the hospital I did my placement, very busy place, but they can't really. It's challenging for them. Cultural differences. For me, as I said, because it's observational, so I was more watching, learning, and asking questions, reflecting, that's all.
Okay, brilliant.
Yeah.
Now, how did you adjust to working in a healthcare system that relied more on traditional knowledge than on the latest research or technology?
To be honest, I think I've mentioned some of this before. As my NMC Code of Conduct offers me a solid framework of my practice, which I really can't use in there because they don't use the same practice. They don't rely on the same standards. So it was just for me to learn and ask and gain experience.
Did you take any resources over with you at the university? Because I know I spoke to an orthotics and prosthetic student who went to Uganda, and they were able to pack lots of resources to take in their suitcase. I don't know if that was the same on your course.
I don't know. To be honest, I took some of the equipments with gloves. I took gloves offered by the ward, the placement that I'm in, because when I talked to the matron, she just offered me 2-3 boxes of gloves, face masks to help myself, my colleagues in there, because they don't really use much of this infection control equipment, like PPE equipment, What skills have you gained during your placement in Zanzibar that will benefit you in your future nursing career? Yeah, so through this experience, I gained valuable insight into nursing practice, allowing me to refine my personal expertise. Networking plays a crucial role, to be honest, in this placement. I had the privilege of meeting and collaborating with individuals from diverse backgrounds, leading to forming like a global networking and relationships. Other skills like boost my confidence. I feel my problem-solving abilities are better, and it provides me with a fresh perspective into life and aspiration. Brilliant. And how did the experience shape your approach to global public health and your role as a nurse in such initiatives? Going in there already, it's a global intervention, a global placement. Participating in this placement really provide with important insight into global health, especially about health disparities, inequalities in health, the key role of managing resources in different settings, working with various cultural practices which improve cultural understanding, helping healthcare providers which offer care for that respect patients' background and communicate effectively with diverse individuals. It was really a unique placement or unique healthcare environments to build my adaptability and enhance my problem solving in a situation with limited resources. As I said before, if a crisis happened like the pandemic, I know I have better skills maybe to adapt and to carry on care for my patient with maybe low resources, different like from going to placement to go into digital and so on,
Definitely. Now, if you were to offer advice to future students that are considering a placement abroad, what would you say to them?
It's just easy. Step out of your comfort zone. Give it a try. You will gain a valuable insight into experience, and even if you face challenges, just don't hesitate to go.
Brilliant. Now, you mentioned your intention to get involved in more volunteering opportunities in the future. What areas or types of volunteering are you most interested in pursuing?
Clinical practice is one of them, but I want really to volunteer in clinical support on public health initiatives, participating in programs which aim to improve the public health infrastructures and the clinical practice in the equities, the places that they don't have access to healthcare. So really nice.
Great. Now, how has this placement affected your career aspirations or the direction that you see your future nursing career taking?
So this placement has shaped my nursing career, to be honest, in a key ways. First, it broadens my perspective as its exposure to different healthcare settings enhance my global health awareness and culture competences. It enhance my skills as I working with resources limited settings, improve my adaptability and deepen my empathy. Career aspiration, so this experience inspires me to engage in a public health initiatives, volunteering work and health advocacy. Personal growth, the reflection about the experience which foster my CPD, continuing my personal and professional development. It's enriched really my skills.
Yeah, it sounds like you've taken so much away from the experience, which is it's just so good to hear, because I know that it's just great opportunities out there for students to do these work placements and expand on their knowledge and life experience. Now, finally, as a closing, what do you hope that others can take away from hearing about your experience?
You just have like an introduction for you to know what's really going to experience. It may not be the same experience as I have, because we're all different, but I'll say just give it a go. If you have the chance, you won't regret it. You will gain a lot of experience, and you will come with valuable insights, and you will talk about it the same as I'm doing now.
Brilliant. Thank you so much, Amira.
Oh, thank you for having me, Laeticia. Thank you.
Now, if you listeners want to find out more about study exchanges or work placements, then please visit the Student Hub International Opportunities page. There you can find out about our drop-in sessions, application processes and partnerships. I'll see you in next week's episode, where we'll be hearing from more of our amazing students about their overseas placements. Please like, share and subscribe to this podcast so you can hear more, and we can spread the word about our international opportunities. We'll see you next time.